Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
This is Medicare Moments. Toni King is your host for this weekly podcast. You know, Toni, we have a new podcast for everyone every Wednesday morning.
That's good because people need help and everybody has a different situation. It's not always the same. Like the insurance companies want you to think everybody is the same. You're not. My Medicare is not the same as your Medicare.
You're right. It isn't. You just helped me change my Medicare too, my supplement. So thank you very much for that.
And that worked out really well.
It has. Yes, it has. So Toni, we have this question from League City, Texas, which says, Toni, can you please explain what one turning 65 and working full-time with employer benefits should do? I made a big mistake enrolling in Medicare when I turned 65 in May, and my Part B premium has exploded because of what my income is. I would like to know how I can stop my Medicare Part B. Thanks, Tiffany from League City. Toni?
Oh, this is a fun one because people don't know that once you sign up for Medicare, if you're still working full-time with True Company Insurance, you can stop your Part B because they don't realize that Medicare is based off of how much money you make. The premium is based off of what your income is, not just a set premium for everybody. So if you make more than a certain amount of money and it changes every year, then you're going to have to pay more for your Part B. And you don't want to do that.
So you're saying you can put Part B on hold?
You can go back and cancel it and put it on hold, but you have to stop it. So she enrolled when she first turned 65, and the numbers are really, really and truly totally changing. If your income is more than $103,000 as an individual, you're making more than 103, you're single. Or if it's more than $206,000, that's as a couple, then your Part B is going to cost more. People don't realize that. And they pay it for years and years and years, and they don't realize that they could have stopped it because they're still working full-time with True Company Insurance. So it all depends. You want to take your time. That's why we have our Medicare consultations, and we sit down with people and let them know what they need to do. You could work for your company until you're 80 years old, and then you decide you want Part B. So don't listen to who's calling you when you're turning 65. They want you to sign up for Part A and Part B if you're working full time with True Company Insurance because they want to make that commission for that Medicare supplement or that Medicare Advantage plan.
And as you say all the time, everyone is different. You're listening to Medicare Moments. Toni King is your host. Thanks for joining us on this podcast every week, and we'll be back right after this.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Medicare Moments with Toni King is the podcast, and we're talking about Part B, and Toni's here to make sure that you don't make the mistake of overpaying if you don't need it. Right, Toni?
That's right. Then on page 19 of the Medicare and You handbook, it says, should I get Part B? And it talks about delaying Medicare does require you to have employer group health insurance. If you're self-employed or you're not working, you need to enroll in Medicare Part A and B. But if you're still working with company insurance, then you can delay it. Tiffany signed up. So Tiffany needed to file the form CMS 1763, which is what she could do to delay her Part B. Now, she would still have to pay the premium for the months she's been on Medicare, but she could delay it. Social Security's number is 1-800-772-1213. You can call them and stay on hold, and they will answer your question. Or you can call your local Social Security office and talk to them. I like the local. I get in real fast.
Well, I also did the 800 number recently, and it was a long wait. I think it was an hour and a quarter wait. So they also then gave me the option to have them call me back when it was my turn. And I did that, and they called me back within less than 2 hours. So, Toni, we're going to talk about Medicare enrollment situations that really do matter and really do make a difference in what you're going to do.
And people don't realize there are Medicare situations that do really matter. It matters to you. It matters to your spouse or whatever. So what if you're a working spouse? Does that really matter? Yes, because if you're a working spouse and your non-working spouse is on your group health insurance, he can delay his Part B. I mean, that's important. If you're still working and your spouse is on your insurance, then they are not working. You can delay their Part B until you finally retire, because right now they're on your company insurance. Why pay the extra money? What I would do is look and see what the Medicare supplement or the Medicare Advantage plan would cost compared to what your company's health insurance. What's your income? What is your Part B going to cost? I'm still working. You're still working. And I'm having to pay for my Part B because I am on Medicare, but I'm still working. That's important. You know, you got to get in the game. You can't just let somebody make the decisions for you.
If you're self-employed, does that matter?
I'm self-employed. Yes, that does matter. And you are self-employed. And yes, that does matter. I was self-employed. I had an individual health insurance plan. I couldn't wait to get on Medicare. This has been the best insurance I've had. And so I enrolled in Medicare. I got Part A, Part B, started when I turned 65. And it's been the best situation that I could have done. If you're self-employed and you never enroll, and then you finally decide to enroll, you will get that famous Part B penalty. I promise you.
And that penalty can be very costly, something that you might not have been expecting. We have some different options for enrolling in Medicare when turning 65. So you want to talk about them, Toni?
Go for it.
Okay, well, turning 65 and still working, talk to your employer's human resources department. Verify whether you should delay enrolling in Part B because you or your spouse are still working and are on employer group health plans. As soon as you or your spouse are no longer covered by an employer group health plan or plans, have your HR department fill out and sign the Social Security form CMS-L564. And by the way, we know we talk about these and you hear them. They'll be in the description to this particular podcast. So these form numbers will be there for you. That form, by the way, is request for employment information. And the CMS 40B, application for Medicare Part B, filing these forms together will justify your delay in enrollment and avoid needless penalties. And that's what you don't want, right? Are the needless penalties.
And you will get the penalties if you don't file the forms properly. So if you're someone who's leaving work, please don't wait till your COBRA ends. COBRA ends in 18 months. Medicare only gives you a certain amount of time and you will get the penalty. So the second you come off your company insurance, you want to make sure you file the CMS L564, the request for employment information, and the CMS 40B. What that does is tell them what first day of the month you want your Part B to start. The CMS L564 is what your company fills out. That's important. But please don't wait. A lot of companies lay people off. They pay for you for COBRA for a certain amount of time. You're not working full time with True Company Insurance. You want your Part B to start the day that you come off your company insurance.
And that's important. So if you're on COBRA, you're really not working with full company insurance, correct?
Medicare doesn't consider COBRA as employer benefits. They consider COBRA as an individual plan, and it's highlighted. I mean, they've got it. They say, but who's going to come and read the Medicare New Handbook to find that out?
But that's very important. And that's a great tip from Toni King to know that if you have COBRA, doesn't mean you have a group health plan with your employer. That's the important thing to know.
And then turning 65 and receiving your Social Security check. Okay, you're turning 65 and you're receiving your Social Security check. You're going to automatically get your Welcome to Medicare kit. And in it is your Medicare card. We have people bring a whole package of mail they get, and they have no clue that their Medicare card is in that stack. They haven't opened it up yet. Because you're bombarded. I mean, people need to realize you have call centers from the Philippines, from Jamaica, from India calling you over here. They know your phone number. They know you're getting on Medicare. So you gotta be careful. And then if you're turning 65 and not receiving your Social Security check, like I said before, if you're working full time with company insurance, this is not for you. If you are someone who has an individual health plan and you're turning 65 and you're still working, you're self-employed like I was, then you want to go online and sign up. And we have these articles on the Toni Says website.
The Toni Says website, TONISAYS website, has a lot of information to help you. And Toni even has created webinars that you can take advantage of and walk through the process. And Toni has the book, the Medicare Survival Guide Advanced Edition. It's available at tonisays.com. So lots of information there to help you if you would just take advantage of it just by visiting Toni Says, TONISAYS.com. Toni writes articles. There's lots of them, and they're resident at seniorresource.com. So you can go there and see Toni's articles. And she may even be in a newspaper close to you. Many of our newspaper readers write us. So don't be shy. Give her a call, 832-519-8664, 832-519-8664, and visit tonisays.com. So Toni, back to you.
Sounds good. Well, I'm ready to go for our next podcast, whichever one we're doing next. Today's a busy day. We are getting ready for Medicare's annual enrollment period, and that is coming around October 1st. We'll start talking about what's going to happen next year, right?
Correct.
Because it's going to be fun.
Yep, there'll be a new Medicare year coming, and that's why it's important to make sure you keep Toni's podcast fresh and available, because Toni will bring you up-to-date information when it's available and when it's allowed to be discussed. Right, Toni?
Sounds like a winner. I'll talk to you later, Jim. Have a good day.
Hi, I'm Toni King, host of Medicare Moments podcast. Join me every Wednesday as I share tips, strategies, and little-known facts I've learned over the past 20-plus years. I put Medicare into people terms, and I want to help you personalize your Medicare, because with Medicare, it's what you don't know that will hurt you. Medicare Moments is available now anywhere you listen to podcasts.